Hello, I'm Dr. Furkan Erol Karabekmez. I graduated from Istanbul Faculty of Medicine in 1999. I completed my specialization training in 2009. We have been working in our private clinic for about a year. Rinoplasti surgery involves the surgical correction of the external appearance of the nose. There may also be breathing problems. During the same operation, breathing problems and the external appearance of the nose are corrected. Rhinoplasty surgery can be performed on any individual who has a defect in appearance, but the patient should not have a chronic illness. If the patient has a disease such as diabetes and hypertension, there needs to be extreme caution. We generally don't want to operate before the age of 17, because the nose shape may change as the nose continues to grow. That's why we want to do it after the age of 17. If there are no other complications, and there is no deformity in the shape of the nose that everyone can see, patients are suitable for the nose surgery. If there is a belt on the back of the nose, we lower the belt down with the operation. We lower it 1 mm lower than the tip of the nose. If the tip of the nose is tilted downwards, we lift it upwards. A 90-degree angle for men and a 95-degree angle for women makes it look more natural. If the root of the nose is too wide, we narrow it. If the tip of the nose is large, we minimize it. If there is a defect between the two nostrils, which we call the septum, during rhinoplastic surgery, we correct them. In rhinoplastic surgery, as in all surgeries performed under general anesthesia, you can't eat anything before the surgery. You have to fast for 6 hours. We do routine blood tests, chest x-rays, and heart ECGs before surgery. If there are no problems, we take the patient into surgery with minimal risk. Before the surgery, if the patient smokes, we ask them to stop smoking for 1 to 2 weeks. If they use blood thinners such as aspirin or green tea, we ask them to stop for 2 weeks. Rhinoplasty surgery is not a difficult operation. If open rhinoplasty was performed, a pink line will appear there for the first 1 to 2 weeks, as we'll make a tiny incision between the two nostrils of the nose. Afterwards, a barely visible scar is left. If closed rhinoplasty has been performed, there will be no scars on the outside. There are scars in the nose, but they are not visible anyway. Thanks to narcotic substances we use for the nose during and end of surgery, patients wake up from surgery in a very comfortable way. They do not feel any nasal pain. 1 week after the operation, you experience swelling on the face. If bone was cut, there may be bruises around the eyes. During this period, we recommend patients to protect themselves from the sun. It is an easy operation because people cannot notice that you have undergone an operation. It heals quickly. The first month and a half after rhinoplasty, patients should protect their nose against impacts. They should not wear glasses and should massage their nose. These massages are done to stop the swelling, which we call temporary edema. Apart from this, they need to clean their nasal passages. Patients should come for checkups. There are risks, as is with any other surgery. Let's say this risk is around 5% for those who had the first surgery. There may be a need to perform another operation. The reason for this is that the nose is in the middle of the face. Muscles in the whole face are the attachment point and the cartilages have memory. So some patients may have a downward bending, displacement, and a very slight asymmetries concerning their nose. Therefore, re-intervention may be needed. Other than that, re-intervention is not needed in 95% of the patients. In general, our risks are minimal in patients who follow the post-operative recommendations well and have a good follow-up. The patient usually comes to our clinic on the 3rd day after the operation to remove the tampons inside the nose. The first week after the operation, they come for the removal of the plaster on the back of the nose, which we call sprint, and the removal of the stitches on the lower part of the nose. After that, we expect the patient at the 2nd week, 1st month, 3rd month, and 6th month at our clinic. Also, we want them to come after a year. Wish you all a healthy, happy, and good day.